Hi, this is Pratima and you are watching Planet Physiology. Today we shall study an important topic, diuretics. You may immediately get a question, what are diuretics? So, diuretics are the substances that promote diuresis. And diuresis means increased excretion of water in urine. Hence, diuretics are the substances which increase water excretion in urine, or in other words, which increase urine output. Due to this reason, diuretics are often used to reduce extracellular fluid volume in treatment of hypertension, congestive cardiac failure, liver cirrhosis, renal diseases, to eliminate drugs, to relieve edema of pregnancy and glaucoma. Before we discuss diuretics in detail, let's quickly brush up the topic renal handling of water. Normally, kidneys reabsorb more than 99% of the filtered load of water, and out of this, about 65% is reabsorbed from proximal convoluted tubules via transcellular as well as paracellular routes. Aquaporin 1 water channels play important role in transcellular water reabsorption, and this is obligatory water reabsorption. Descending limb of loop of Henle reabsorbs about 10 to 15% of the water with the help of aquaporin 1. Late distal convoluted tubules and cortical collecting ducts also reabsorb 10 to 15% of the water, but in presence of ADH and also under the influence of aldosterone. This is facultative reabsorption of water and is mediated via aquaporin 2 water channels. Water reabsorption by medullary collecting ducts accounts for 5 to 10%, and this is also only in presence of ADH. Hence, facultative water reabsorption. With this background, let's discuss various types of diuretics and their mechanism of action. Broadly, diuretics can be classified as osmotic diuretics, carbonic anhydrase inhibitors, loop diuretics, thiazide diuretics, aldosterone antagonists, and sodium channel blockers. Let's start with osmotic diuretics like mannitol, glucose, or urea. They act at proximal convoluted tubule as well as loop of Henle. Mannitol is osmotically active substance. When introduced in body, it is freely filtered but not reabsorbed by the tubules. As a result, it reduces water reabsorption and increases water excretion, that is diuresis. Similarly, when filtered load of glucose increases, as in case of diabetes mellitus, it also induces osmotic diuresis leading to polyuria. Infusion of large quantities of urea or sodium chloride also induce osmotic diuresis. Mannitol also acts as plasma expander, which increases extracellular fluid volume and hence renal blood flow, especially in peritubular capillaries. This decreases medullary osmolarity and prevents urine concentration. That means it increases water excretion. Next class of diuretics is carbonic anhydrase inhibitors. As name suggests, these drugs inhibit the enzyme carbonic anhydrase in proximal tubules. An example is acetazolamide, also known as Dimox. Due to inhibition of carbonic anhydrase, hydrogen ion excretion is reduced. As a result, sodium excretion is increased because hydrogen secretion in PCT is coupled with sodium reabsorption. As sodium is osmotically active, water reabsorption is also reduced and hence water excretion is increased. These drugs also increase loss of potassium and bicarbonates in urine, and hence use of carbonic anhydrase inhibitors may cause metabolic acidosis and hypokalemia, leading to muscle weakness and arrhythmias. Now coming to the loop diuretics. These are very powerful diuretics. Example is furosemide, commonly known as Lasix. As name suggests, these diuretics act at the level of loop of Henle. To be specific, thick ascending limb of loop of Henle. They inhibit NKCC2 transporters and hence interfere with countercurrent multiplier system. Thus, they prevent generation of medullary interstitial hyperosmolarity. Thus, loop diuretics increase water excretion by preventing urine concentration ability of kidneys. Loop diuretics are used in treatment of edema due to congestive cardiac failure, nephrotic syndrome, liver cirrhosis, acute cardiac failure with pulmonary edema and in hypercalcemia. Adverse effects of loop diuretics are hypokalemia, that is decreased serum potassium, hyponatremia, decrease in serum sodium levels, hypovolemia, decrease in extracellular fluid volume, hypotension, hypocalcemia means decrease in serum calcium levels. It also causes certain hypersensitivity as well as ototoxicity, that means it is toxic to ear. Next type of diuretics are thiazide diuretics. Example is chlorothiazide. These diuretics inhibit sodium chloride cotransport in distal convoluted tubules, thus increase their excretion and hence water excretion in urine. Now coming to aldosterone antagonists like spironolactone. They act at principal cells of collecting tubules. As name suggests, these drugs inhibit action of aldosterone on principal cells. That is, they inhibit sodium-potassium exchanger or sodium-potassium pump in collecting tubules. Thus, aldosterone antagonists increase sodium excretion and hence water excretion in urine. Since these diuretics cause potassium retention in the body, they are known as potassium-sparing diuretics. And the last type of diuretics are sodium channel blockers like amiloride. They also act on principal cells of collecting tubules, but they cause inhibition of epithelial sodium channels, that is ENaCs. Hence, by reducing sodium reabsorption, they promote water loss in urine. Since these drugs also inhibit potassium excretion, they also fall in category of potassium-sparing diuretics. Apart from these diuretics, other substances also induce diuresis. For example, ethanol inhibits ADS secretion leading to diuresis. Amphotericin and lithium act as V2 receptor antagonist and prevent action of ADH. Thus, they prevent water reabsorption leading to increase in water loss in urine. Dopamine acts as antagonist of sodium hydrogen exchanger in PCT. Xanthines like caffeine, theophylline and theobromine inhibit sodium reabsorption as well as increase GFR leading to diuresis. Let us wind up this session by summarizing the important diuretics. Osmotic diuretics like mannitol induce diuresis by osmosis, while carbonic anhydrase inhibitors like acetazolamide prevent hydrogen secretion and hence promote sodium and hence water loss by the kidney. Both these act at proximal tubules. Loop diuretics like furosemide inhibit NKCC transporters in thick ascending limb of loop of Henle and prevent urine concentration causing diuresis. Thiazide diuretics inhibit sodium chloride reabsorption at DCT. Potassium-sparing diuretics include aldosterone antagonists like spironolactone, which inhibits sodium-potassium pump, while sodium channel blockers like amiloride inhibit ENaC. Both these types of diuretics promote sodium and hence water loss in urine, and they mainly act on the collecting ducts. So this is all about diuretics. Thank you for watching and see you in the next video. If you like my presentations, don't forget to hit like button and share with your friends. Do subscribe to my channel and hit the bell icon to stay updated about new releases on the channel. Thank you for watching and see you in the next video.